Hi there, my name is Zaim, and I'm going to quickly show you how exactly you use Kiroku once you've got it all set up. So this is my account here, and I'm going to go through a new patient exam template, our stock one, which you can add to your account. Now, each Kiroku's template is broken down into different sections, which you can see in these cards. So we've got new patient exam, social history, medical history, etc., with your radiographs and everything later on. And each section has different notes. So each line of your normal dental notes. You'll notice firstly that you've got lots of buttons. So in each section where you've got a variety of different options, you've got some easy to click buttons. And this makes it easier for you or your nurse who's listening to your conversation with the patient to just go through and select what's relevant for your appointment. So let's say I want to select my nurse JS. The patient is coming complaining of pain, and this button is linked to what my normal pain history would be like. So I can say it's from the upper right 4, and I'll fill out some of the characteristics, and that's my pain history is done. So usually my nurse does that whilst I'm speaking to the patient. And say, for example, I haven't asked a couple of these questions, I can always use the X on the left here to delete some of those things there as well. So moving on to social history, if the patient's nervous, it'll pop up with a little selection of what makes them nervous. And if they're a smoker, you can add links. So these are called links where when you press a button, other things output in your template automatically. So say they're a smoker and they smoke 10 a day, you'll notice that because I've selected that in my social history, if I scroll down to my discussion section, it'll highlight what I normally type when I see a smoker patient and what I say to the patient. So I'll tell my patient about smoking cessation, and Kiroku's got that option there already. If I hadn't told them about it, I can always delete that there when I want to. So if I scroll back up into social history and we go to alcohol, say they drink a lot, and I want to add occupation, you can always add any text wherever you want in your template, and you can always delete things in your template as well. So you still have total control over what goes in your notes. So let's say they're fit and healthy, say we didn't ask about special needs. They fill out all the information, so they brush once a day, no incidental cleaning, and we've got a bad patient here. So you'll see the dental history when I've been talking about this with my patient, my nurse is clicking through what the patient's saying, and then Kiroku in the discussion section is automatically outputting the normal advice I give to all of my patients so that it's there in my clinical records and I haven't spent ages after the patient typing it all up or copying and pasting it from elsewhere. So same with extra-oral exam, say there's nothing to note there. In the intraoral exam, say there was a lesion or something I wanted to record. If I click on other and say it was some trauma on the palate and everything else is fine, that's easily filled out. So let's keep going. So BP score, say the patient's got a BP score of 3, poor oral hygiene, and I'll click some more. So generalized plaque, and they've got some caries in that upper right 4 that they were complaining of, and say everything is okay. So again, my nurse finds it really easy to flow through this, and if I didn't make a note of the crowding or anything, I can always delete things as usual. We've taken some bite wings, so my bite wing reports come out, bone levels are all normal, and say some calculus building up on the bite wings there. I've accidentally clicked nil on the caries in the bite wings, so I can always delete that and type upper right 4, so your notes are still fully customizable, and we didn't take any PAs. So my diagnosis, because I've already charted caries, it's already written caries here, and it's outputted the perio classifications. So say this general, and say the patient's stable, and they're a smoker. So my periodontal and my caries diagnosis is outputted. My discussion around periodontitis, about caries, about the oral hygiene habits is all here, and I've told my patients to start using TP brushes. And in my treatment plan, I can write filling, upright 4, composite, recall, next visit filling, and my risk assessment and my notes are complete for my checkup. Really quickly, so got a thorough patient record here with all the information that I need. My nurse has found it really easy to follow through and click through the different options. And what I can do now is on the top right hand corner, I click copy notes, and that copies the notes to my computer's clipboard. And if you're using SOE, R4, Dentally, wherever you do your notes, all you have to do now is click paste, and the notes will output in text in that area. So that's the fundamentals of Kiroku and how to do an appointment. You can watch any of the further videos to go into a little bit more detail on how to edit your templates and how to do different things on the platform as well. So if you need any help, on the button on the bottom right hand side here, if you press this, you can send us a message and we'll be able to help you out. Okay,